Hey everyone, how you doing today? Hope you're having a great day. It is Monday. Today is the 24th. So just wanted to post another video for you guys. I know I started a little video yesterday. I want to give you a bit more details today. So like I said, my name is Randy. And as far as me, just a little bit about my history, I'm going to start first of all by saying I just want to give all glory to God, because there's no doubt I wouldn't be here today if it wasn't for God. No doubt in my mind. I've always had a pretty close relationship with God, and I just think over the last 3 years, definitely the last 2+ years, it's got so much closer. And I'll go through that, like I said, bits here and there over time. And feel free to ask questions, comment on anything that you want to know about that I haven't shared yet. I'm more than happy to reply to you if it's a quick thing, or maybe talk about it more in another video. But yeah, about, let's see, where is 2025? So this was, I guess, late, probably later in the fall 2022, that I started getting headaches, and they were pretty small at first. They was like minor headaches to where I'm like, oh, let me take some Tylenol or ibuprofen or something like that, and that'll just take care of it. And it worked for a while, and then after that, they started getting worse. So then I had to grab a hot towel, warm it up, and, put it right on my head. And then eventually I had to get into a quiet place and a dark place and just kind of sit there for several minutes, maybe 5 minutes or so, for it to go away. And then it got steadily worse than that, to where I was getting woke up in the night with crazy painful headaches. And I said Tylenol wasn't doing it. I would just suffer these massive headaches, or I feel like I was going to pass out or throw up, or both. And I would sometimes fall asleep by laying by the toilet. It was pretty bad. So did that for a while, and like a lot of guys, guys are kind of stubborn, not wanting to go to the doctor on that one or get things checked out. I'm like, oh, I'll just put a Band-Aid on it. It'll all be good. It'll be fixed, no problem. And then eventually I was like, okay, this is not normal at all. What the heck's going on? Even my wife at first, and her personality's kind of like, oh, why are you being a baby? Just suck it up. And I think she even realized, like, wow, this is for real. And I went to the doctor. So I went to my primary care doctor, and then she referred me over to a neuro doctor, who referred me over to a neurosurgeon doctor. And of course, they were doing more than talking to me. They were like understanding my history and getting details. Once they got to the neuro doctor, they did a few scans, he made recommendations for scans, but he recommended the neurosurgeon to do the actual scans. And the neurosurgeon said, yeah, we gotta get some scans on you right away. So they got some scans on me, and they called me back pretty quick, a matter of weeks. And she said, all right, we need to get you in for surgery right away. And basically what happened was the headaches I was getting was caused by spinal fluid backing up in my head. It wasn't flowing down my spinal canal like it was supposed to, backing up in my head. I'm like, why is that happening? And she showed me, and she said, yep. She said, you see this white area here? That shouldn't be there. So they basically found a brain tumor in the back of my head. It was blocking it. It was a pretty small tumor. They did some tests on it, and fast forwarding quite a few months here, they found that it was benign, but basically it's a pretty bad thing. And they said there was a good chance that if I had not come in, got that done, and then actually, like I said last time in the video, the shunt was put in to release some of the pressure, and basically rerouted that. It goes all down the side of my head, down my body into my stomach, and releasing the spinal fluid there. They said if they had not been done, they said there's a good chance, probably within another 90 days, there's a good chance that I could have died, or definitely gone into a coma, and good chance I would have died. So very eye-opening to see that happen. And I would just tell you guys, if you're in the situation, feel free to comment. Love to hear about it. Anything going on like that I just recommend you pay attention to your body. I'll share more of that too as time goes on in videos, but you definitely got to pay attention to your body and not ignore signs. And I know for me, I probably drive my wife and kids. I know I do probably drive them nuts sometimes about sharing those, because I'm so curious about anytime something happens, I'll, ask different things. I'll ask AI bots on stuff. I'll do research on social media. I'll ask their friends or family or anybody that's dealt with this before, because I want to know what's going on. And I highly encourage you, if you're in that situation, even if you're not in a situation, just it's very smart to pay attention to your body and research and do healthy things for your body. Because that's one big goal for me right now, is to focus on a lot of healthy things for my body. That's really, really important for a lot of folks to do that. I've learned a lot about that too. So again, fast forwarding, past me, I actually got the shunt put in, the surgery that was late summer of 23. And then they put me on steroids. Oh gosh, if you guys ever have to go on steroids, whew, be very careful. I'm not saying, they serve their purpose, but be very careful if you have to go on steroids, because it's a rough road being on steroids. I was on steroids for almost 2 years, and I was actually told by a couple of my doctors that, like, hey, you're going to be on steroids the rest of your life. And me and my wife were like, nope, not happening. So we did a lot of our own research and found ways to slowly taper down on steroids. And the doctor was very, very surprised when I was off of steroids. And she was like, wow. She's like, wow, Randy, you did it. She's just shocked. And I was able to get off steroids. Now, right now, post steroids, I've been post steroids for a couple months here, and it's still a rough road. You gotta, even though your body doesn't need the steroids anymore, your body's having to retool and recalibrate and get used to being off of that. So another thing too, I've learned a lot of experience on is secondary adrenal insufficiency. That's caused by your body being on steroids. A lot of folks have that issue the rest of your life. And that's why they have to stay on the steroids. But like I said, I've been blessed by God. I know 100% all glory to my God for getting me off these things, and thank my wife for helping me a lot too. But God's one that got me off these steroids. So very good there. Okay, so going back to me, as far as my journey on, the brain surgery and everything for the shunt being put in, it was a rough road. So another thing I will tell you, anytime a doctor tells you, oh man, it's a very simple surgery, you'll be in and out of the hospital in a day or two, very simple. Maybe it's an outpatient, or for me, it was an inpatient thing. I believe I was supposed to be in and out one day in the hospital, supposed to be there 24 to 48 hours. I was in the hospital for 10 days, several days in ICU because I coded twice. I almost died twice. So nothing is simple surgery. I'm not saying that to scare anybody, but I'm just saying that to do your own research, pay attention. If there's a way of getting something done without surgery, I would tell you surgery, if it needs to happen, okay, it needs to happen. But for me personally, surgery is kind of okay if that's my only option to have a last resort, because you also have a lot of recovery time on that one. Like for the first few weeks, I had a lot of things that were bad. I still have a lot of post-surgery things I'm dealing with. You guys may not notice this, but I'm wearing hearing aids too. So, never had any kind of hearing issues at all. Wearing glasses here. These are actually specialized glasses called prism glasses to actually fix my double vision, because at first I was blind. Couldn't see a dang thing. I saw I guess things I would see on the movies, like, a colorblind would see person, or not colorblind, a blind person might see like shapes and some, kind of frames of people, but it just blurbs, I couldn't really see hardly anything that scared me. It lasted like that. I think I was like that for a day or two kind of thing, maybe a little longer. And then I had to use a walker because I had no strength or energy to walk kind of thing. I had vertigo really bad. My balance was off. So a lot of side effects from that, quote, simple surgery. So be very careful with something like that. And again, everything I'm sharing with you guys is just on my own personal experience. Please don't take this as medical advice. As far as educational, this is my own personal experience. If you want to take some kind of educational stuff out of that, that's fine, but it's not direct academic educational stuff. So I just want to put that disclaimer out there for you guys. So I would encourage you, if you have to go for something that requires surgery, your doctor's recommending surgery, just do your due diligence and research it and make sure that it makes sense for you. Okay, so got out, like I said, out of the hospital, post-surgery, and I couldn't do anything. I was had the walker, couldn't see. Finally, my vision got better. Well, then, while I was in the hospital, I had ghost images and double vision. They're like, oh, that'll go away too in a few weeks. No, not for me. So we're 2 years plus on that one. Now, I'm trying to work through things to, in Jesus' name, get better. I'm claiming and praying that it is going to get better. My claim is going to get better because God has always taken care of me on things, right? God's always taken care of me and watched out for me. Sorry, somebody was trying to call me. because of God is why I believe it's going to get better, not because of just me on things. So, um, all right. So now, post surgery, yes, I can see again. Yes, I can drive, but my vision is not the same. Meaning, like at nighttime, I can see, but it's not as clear. I think so. I have to be much more careful to try and drive night. So I don't really go right now a long distance on that, and that could be coming off the steroids because I'm dealing with a lot of crazy, odd symptoms, coming off of steroids. And if anybody's curious, steroids I was on was that at first I was on a very strong steroid called dexamethasone, and then prednisone. But again, if you're dealing with that and you want to talk about that, happy to give my thoughts on that one with y'all. So if you're dealing with that one. But yeah, I mean, I've felt a lot of changes in my life. I try to eat a lot healthier. So one thing, I used to drink a lot of sodas. I used to drink a lot of Coke. I rarely will drink a Coke, and even rarely drink a soda, like carbonated soda now. I mean, not saying I don't, but it's pretty rare that I drink that now. I try most of my liquids kind of thing. I try to do tons of water. I do some, electrolytes like Liquid IV, things like that with my water. And I will try to do sometimes, juices got sugar in them. So sometimes I'll do a little bit of juice thing, but juicing is a new thing that I haven't got into that yet, but I've been recommended by folks to get into that one. So I want to try that and some other healthy things. One of my goals now is to try to find ways to dry up these tumors on things. I want to get those moved out. I would like to try those up. So I've got some thoughts on that one. So if anybody has anything you want to share on that one, I would love to hear your comments on that one. But they found a tumor in my neck. It's called a paraganglioma. It's right there in my carotid artery. You'll probably also notice too, which I've noticed this a lot, is I have to be a little more articulate when I speak now because I have to pay more attention to that one. I also have to pay more attention to little things, like my typing. Like I type a lot for work and my job, so I have to be more focused on that one, pay more attention to that, and see if I make any mistakes. I may make a few more mistakes than I used to. So little things there. My hearing, I'm very thankful for being able to hear with these hearing aids. Like I didn't have any hearing issues before, but I lost I think it was about 80% of my left ear and about half of my right ear. So all these weird symptoms from this simple surgery that I've never had to deal with before. But it's hard when I'm in crowded rooms, having to hear people and having to say, what would you say? And do the best you can to hear. So I just say, if you're dealing with anybody that's got these issues, just be patient with them, man, because until you're walking in those shoes, it's a lot hard to deal with, right? So anyways, that's kind of a little bit more about my journey. Again, feel free to comment. I'd love to hear what anybody has to say about, hey, I'm going through that as well, Randy, or what'd you deal with this, or where'd you go for this, or how'd you handle this situation? Love to hear any of those. And also, please definitely like and subscribe. But please keep coming back. I would love to hear anybody's feedback. Like I said, my big thing for me personally is trying to live a healthier lifestyle and get rid of as many of these issues and or symptoms that I'm dealing with. And when you're told that you're stuck with this the rest of your life, don't believe it. Don't believe it. I've talked to colleagues, friends, family, other folks that are definitely doing a lot of alternative ideas for medicine too. So if you're told this is the only option for you, I know a lot of folks here, and I was in that same boat, like, oh, you have to use all these drugs. No, I mean, I'm not saying all drugs are bad. That's not what I'm saying. But for a lot of folks, if there's a natural thing, I believe in going that route. That's a much better way. So like fruits, vegetables, anything natural to help your body. And if it's a drug that's well known that maybe doesn't pay as well, doesn't make as much money, you're probably not going to hear about that in the medicine world, especially the Western medicine. But hey, maybe that's what's really good for you. So, all right, again, please like and subscribe and definitely leave comments. I would love to hear what y'all have to say. All right, thanks so much. Talk to you soon. See you guys. Take care. We'll talk soon.